The Operative Standards for Cancer Surgery, a resource for resident and fellow surgical education. In this video, we will briefly introduce the Operative Standards for Cancer Surgery and highlight how these comprehensive technical guidelines can be used as a tool to support surgical trainee education. The Operative Standards for Cancer Surgery manuals were developed by the American College of Surgeons Cancer Research Program in an effort to improve the quality of cancer surgery performed. The first 3 volumes cover 15 distinct disease sites and are a comprehensive collection of evidence-based best practices for performing cancer operations and elements associated with improved oncologic outcomes. Essentially, these manuals describe the important technical aspects for cancer operations associated with improved oncologic outcomes. To facilitate implementation into clinical practice, the Commission on Cancer adopted 6 disease-specific operative standards as a requirement for COC accreditation. The Operative Standards manuals cover a breadth of topics commonly encountered in surgical training. These operative frameworks highlight the key critical steps of commonly performed operations, facilitating better conceptualization for trainees and learners alike. For example, in the management of breast cancer, a variety of cancer-specific operations and their critical elements are presented. Another benefit of the Operative Standards manuals is the consolidation of commonly tested and evidence-based information pertaining to complex cancer care. In the example of a sentinel lymph node biopsy, a detailed recommendation is provided and accompanied by the type of supporting data, recommendation strength, and rationale for the recommendation. Furthermore, these standards have been shown to improve patient and oncologic outcomes. Surgical trainees can utilize the Operative Standards for Cancer Surgery manuals throughout the duration of their training. These standards can provide a framework for cancer surgery, bolster technical skills, and provide rationale for intraoperative decision-making. Furthermore, trainees can use these standards when preparing for the ABSITE or board examinations, or when carrying out innovative cancer-related research projects. For surgical trainees navigating the operating room, these standards can serve as a framework for performing commonly encountered cancer operations. For example, when preparing for a partial colectomy for colon cancer, trainees can reference the Operative Standards for Cancer Surgery Volume 1. Within the colon chapter, trainees can find a detailed description of the key critical technical steps for performing this operation, such as proper bowel mobilization, high vascular ligation, and en-bloc lymphadenectomy. The summarization of these key technical elements may not only help trainees to create a framework for approaching these cancer operations, but also help to better conceptualize why certain technical steps, such as performing the extent of colon resection in respect to the arterial supply, are important to oncologic outcomes. Additionally, relevant intraoperative images can also be found in these textbooks to further help conceptualize a framework for cancer operations, such as this example showing high ligation of the inferior mesenteric pedicle during a sigmoidectomy for colon cancer. In addition to being a resource for learning the key technical aspects of certain cancer operations, trainees may also find the Operative Standards manuals insightful when navigating the operating room and help to better understand why decisions are made pertaining to cancer care and how to anticipate them. When performing a wide local excision for cutaneous melanoma, how is the margin width determined? The Operative Standards for Cancer Surgery Volume 2 outlines the critical technical elements when performing curative intent wide local excision for cutaneous melanoma, and importantly, discusses the rationale for selecting the extent of margin width based on Breslow thickness. This recommendation, as well as others found throughout these manuals, are supported by numerous landmark studies, all of which are referenced for reading. These Operative Standards textbooks can also serve as a surgical atlas of sorts, helping to improve surgical skills and knowledge. In addition to providing trainees with a framework to approaching cancer operations and the rationale supporting critical steps, the Operative Standards manuals also provide in-depth technical information that may help to develop surgical skills. Using total mesorectal excision as an example from the Operative Standards for Cancer Surgery Volume 2, a great level of technical detail regarding the critical elements of this operation can be found. Step-by-step details are expanded on as they relate to specific aspects of cancer operations, such as tactical insights when developing the posterior plane during a total mesorectal excision and key anatomic landmarks to consider. The consolidation of this relevant technical information may allow trainees to better utilize their operative experiences due to a better understanding of these procedures beforehand. These manuals are a concise and comprehensive collection of the most up-to-date best practices for commonly encountered cancer operations. For busy surgical trainees, these manuals may be a useful resource when preparing for examinations. As you can see, the second volume of the Operative Standards for Cancer Surgery covers a variety of surgical topics commonly encountered on the ABSITE and board exams, such as thyroid, gastric, rectal, esophageal, and skin cancers. Having difficulty remembering the pathway of the recurrent laryngeal nerve in relationship to the surrounding anatomy, or the anatomic boundaries that delineate the lymph node levels of the neck. All of this information and more can be found within these manuals. Lastly, the Operative Standards manuals may open the door for numerous new research opportunities within the field of cancer surgery through identifying key questions for which there is a knowledge gap and an opportunity for further study. Thank you for your time, and we hope that you find these resources helpful during your surgical training. Please utilize the links provided below for more information regarding the Operative Standards for Cancer Surgery manuals and direct any questions to cssp@facs.org.